Dear brothers and sisters, welcome to a truly historic event organized by Ruqya Healing in association with eMedicard. Today we gather to explore a vital and groundbreaking topic: how to reverse type 2 diabetes. This program is a milestone in our ongoing efforts to integrate innovative healthcare solutions with holistic healing practices. We are very honored to have with us Dr. Abdul Mutalib Khan, a multifaceted professional who has made remarkable contributions to healthcare, entrepreneurship, and media. Dr. Khan, a qualified MBBS, has developed pioneering healthcare platforms like eMedicard and Free Life Doctors in India. These platforms, in collaboration with leading healthcare companies worldwide, offer an interactive personal health record system that is revolutionizing patient care. Dr. Khan's achievement extend beyond medicine. In the year 2009, he was awarded the National Integration Award for his work in writing and producing the film Bhumiputra, which highlighted critical regional issues. His impact in the UK is equally noteworthy, where he served as director and CQC registered manager of a care home in Essex, playing a pivotal role in uplifting the facility standards and significantly boosting its revenue. Today, Dr. Khan's passion for innovation continues as he prepares to launch a mobile app for the beauty industry in the European market. He has also introduced an integrated health platform, that is eMedicard, which combines evidence-based alternative medicine with conventional practices to enhance health outcomes and alleviate the burden on the healthcare system. As we embark on this journey to discover the potential of reversing type 2 diabetes, I would like to express our deepest gratitude to Dr. Khan for his education and vision. Without further ado, I invite Dr. Khan to kindly begin his presentation.
Rahim. Assalamu alaikum, my brothers and sisters. Hope all are doing good. Alhamdulillah. And thank you for the great interaction. Thank you so much for that. So, shall we start now the discussion on reversing type 2 diabetes? Okay. So, let me
Inshallah.
share the screen, you guys. Can you just make me the host, please?
Yes.
Thank you. I'm sharing the screen here. Fantastic. So, let me just start with first understanding what diabetes is. Okay, let's understand what diabetes. Most of people know what diabetes is. We all know that diabetes is nothing but that there's a high sugar level in our body. Correct? High blood glucose in our body. Second, 1 second, please. Let me share the screen. But that I say that thing, what I just said, high blood glucose, is just a small symptom. That is not the actual disease. We're going to discuss a little bit about the actual disease now. Let me share the screen once again. So here, a little bit of understanding of diabetes globally, what's happening related to statistics of diabetes. Diabetes is one of the fastest growing disease in the world. Okay, so currently, they say like almost 537 million people approximately are living with diabetes. That's a quite huge number. And the number is increasing every day as we speak, right? So that they say like every 3 in 4 adults with diabetes live in very low and middle income countries, basically. Because what happened is in recent past, why we are seeing this steep rise in diabetes, it was not there. If you look back a generation before, just 25 years back, 30 years back, there was no so much of incidence of diabetes, right? So now the incidence had skyrocketed. The reason behind this incident, the rise of incident is a lot of reasons are there. One of they think what they have done is we started, it's quite easy and convenient to just say it's like a modern disease, but it's not a modern disease, right? It's a disease because of modern innovations, right? It's because of change of chemicals, change of the structures of the food, what we are eating today. Like genetically modified food is being presented and being sold out to us in shelves and all that. So that's one of the major reasons. Another reason is because the dietary guidelines around the world, like, it all started from 1970s. The dietary guidelines were itself a bust, like it was not at all correct. the first guideline of, if I say, first guideline of dietary guidelines from American food authorities, when they release the first dietary guidelines, they say, right, so you need to have a carbohydrate, the pyramid, like food pyramid says, the base of the food pyramid says you can eat um, carbs, like they allowed you to eat carbs, like you have rice is there, okay with rice, pastas and burgers. So that was, they have prescribed it. They said it's okay to have at least 50 to 60% of carbohydrates in our diet. But that was not there. Previous to that, our old generations, we used to have a lot of healthy fats in our diet. Our elders, our like forefathers, they used to have a good healthy diet in our diet. So that was the reason they never developed diabetes, because the fat was there, protein was in abundant quantity, and the carbs what they were having was not refined and processed. Now what we're getting is a refined and processed carbs, right, which is abundant in the market. And that is one of the major reasons why people have started developing this disease, and disease is increasing multiple folds. So that's the one of the major reasons why this, you see the global epidemic of diabetes around the world. The global epidemic of diabetes is definitely because of the wrong information what we is given to the by the regulatory authorities, by the actually associations, like like American Food Association, then UK followed America, then other European countries followed us. And that's the reason you see, like, people have wrong information about the food. They think the 50-60% of the food is okay, and they have said reduce the fat from the diet. They have considered, they said the egg is with full of cholesterol, avoid that. They said cholesterol, when you eat a lot of cholesterol rich food, you develop cholesterol in the body. That's all actually bust. That was actually, the whole information was given without any proper trial or proper any studies. Okay, so that's the reason you see a growth of epidemic rise. Let me show you the curve, how we have seen the rise of diabetes in such a small span. So here you see the growth, the rise of this. Let me just zoom in here. So people here, they started having the diet, what they said was a healthy diet, that when you're getting from the guidelines, when you're getting information from the guidelines, you think that is a proper information and you try to believe that thing, right? But now recently, if you see in 2016, they have changed it recently. 2016, there's a very latest one. They changed now. They said like for like fats, like health fat, like avocados and nuts, and they're all healthy fat. Otherwise, before that, avocado was supposed to be, they said it is like a very dangerous food with a lot of fat in that. But now it is one of the super foods now. That's all because after proper studies and proper understanding of that, and after seeing this whole big rise of epidemic globally, they realized what happening. Then that's why a lot of people, that trials started conducting. Then they understood the real problem, the real fact there behind it. And you see here in 19 BMI is body mass index. Everybody knows BMI, what BMI is. So like, that 30 is supposed to be obese category. People are obese. So you see the graph here, it's like how people were before when they were having good healthy fat, right? And now you see that has increased to this much, and it's increasing now. It's still continuously increasing. This is what it says. So this is what it says, that like by 2030, it says the total number of people will living with diabetes is projected to rise 653 million, right? And and to unfortunately, the problem is, the other problem, the which is there parallel going, is the role of pharmaceutical industry. The pharmaceutical industry has hijacked the modern medicine. Okay, they have hijacked us, and they have actually put us in blind. They put us in blind. They kept us in blind, and they said, look, these medicines are going to help your patients. But actually, none of these patients have cured after having this medication. I'm going to talk about some of the trials. I'm going to give you some data for you guys, information, so that you. So now before that, let's understand a little bit about diabetes. What is happening in diabetes actually? So we all know what happened in the diabetes, right? Symptoms of type 2 diabetes. When I'm talking about diabetes, here I'm talking about type 2 diabetes only, not type 1. Okay. So type 2 diabetes is basically a dietary disease. Okay. So this is because why people, and the symptoms usually they develop is, they usually be more than usual, feeling thirsty all the time, feeling very tired, losing weight without trying to, and itching around your organs and heel and blood vision. So there are a lot of issues happening with glucose. So what happens, I'll tell you in a small a basic understanding of diabetes is like, what happens is when a bowl, for example, our life, whenever we were born, our bowl was empty, just an analogy. Okay. The bowl was empty. When we filling that bowl with sugar in that, sugar in that, sugar in that, down the line 10, 20 years, that the bowl is full with sugar and it started overfilling it, right? That it's coming, overflowing it. So when it's getting overflowed, it is coming to your blood. That's when it's showing to the blood. Okay. So what is happening currently? What is happens when you eat food? So you eat food in a form of either carbs, right? You eat foods in a form of proteins. You eat food in a form of fats and multivitamins and minerals and vitamins. That's all you eat, right? So when you eat food, you have two things there in the food. You have energy. There are two messages going for the food. One is the energy, and other is the information which is going along with the food, right? For example, you take glucose, it goes in our body, right? It goes to our body, liver metabolism in the form of glycogen in the liver, okay? So that first thing is glycogen. Glycogen storage is very small storage. It's not a big storage. Big storage actually the fat storage. So when the glycogen is that's it's saturated, it started shifting when the limit of glucose is rising in our body, it is getting converted into fats. Simple, right? So whenever we eat food, whenever we eat especially carbs, especially when we eat carbs, what happens? Insulin rises in our body, right? So what you do, insulin, what it does, insulin, the role of insulin is to bring the blood glucose level to normal. That's the role of insulin. It's doing perfect role. That's the natural. That's the role given to insulin. It's performing the role. And second, other role is to convert the fat, to convert the glucose into fat. That's the role given to insulin. And it's performing the insulin, right? But here, what's happening is when you're repeatedly. So let's take an analogy of a train. Okay, so there's a train. If anybody knows Bombay, the Bombay is full of jam-packed trains are always moving. Trains are always jam-packed there. So, for example, there are a lot of people there who's trying to force inside. For example, conductor. Let's take an analogy. The train box as a cell. Okay, and the people are nothing but glucose. Okay, and the conductor is nothing but an insulin. The role of conductor is insulin. So what conductor is doing is pushing the people inside that glucose inside the cell. So at one time, it can't do that, correct? And there's a limit for that. And so what is happening is, so when they're doing it, so what conductor is doing is, I need more strength. So I'm getting another support, my co-conductor, and trying to push it. I'm getting more insulin to push it inside. Then what happening is I'm eating more. When continuously your mouth is your intake is there, you eating the food continuously, regularly. And what is happening is that food is actually getting converting into form of glucose, because glycogen storage already full, right? And glycogen is getting poured out in the blood, right? So that blood, what insulin is that when it sees blood, sees glucose, it says signals, send the signals. It sends the signals and says, insulin, come on, get released. So same thing here. What happening is conductor. He said, now I can't push this. I need more conductors. So I'm getting more insulin. So when I'm getting more insulin, I'm trying to push more. But insulin, what is insulin itself creating insulin resistance? Correct? Because it's converting into fat. When something when something is getting converted fat, the resistance develop in the cells. So what is happening here? It is, if you see, the problem is the insulin here, right? Which is creating the resistance here. Okay. It is not the glucose the problem here. But all the doctors, unfortunately, mostly 98% of doctors, I can say today, the 2% of doctors, they understand, they prescribe what I'm talking today, what I'm going to speak on that. But most of the 98, 99% of doctors, they're still prescribing medications which actually release insulin. And this insulin has two role, basically, two role. One is it pushes the glucose, right, inside the cell, right? Already cell is stuffed, but still pushing that inside the stuff. Insulin is doing that. So what happened? I'll give one more analogy here. So if you see, we have some rubbish in our house. Okay. What we're doing is we're removing the rubbish. What doctors are doing correctly, most of the doctors are doing is removing the rubbish and putting it under the bed, first bed. Bed is completely full now. Under the bed is full now. So what you're doing, you're hiding that same rubbish under some attic, then taking the rubbish, putting in the basement, right? One day what will happen, all this thing will start rotting and then start smelling it. So that is what happening in the body. When doctors are asked, I'm taking medication, you're giving me medication, why my organs are spoiling? Why my organs are getting spoiled? He said it's a progressive disease. But it's a big lie. It's not a progressive disease at all. We were trained completely in a different format. those days, medical schools. It's not the problem with the doctors also, because doctors and most of the doctors are not updated what's happening with this. Okay. So here issue is the insulin. Okay. So what is happening with the glucose? Glucose is a symptom. What is sees there outside is a symptom. So let me just take you there now. So there are a lot of complications out there which you usually get with diabetes. So let me just take you to that share. So I'll show you the issue here. Yeah, here. Fine. So let me just share 1 second. This one. So what is happening here in this, if you guys can see the sheet, the fattening carbs. So the three things we are eating, I said, carbs, proteins, and fats, correct? Majorly, right? So what is happening is when eating carbs, especially refined carbs like pasta, rice, roti, and all that, flour and all that, because they have been completely processed, the layer, the coverings have been removed from the food. Okay. So because of that, you try to eat more, because when the role of the cover is to give you the fiber and give you the healthy feeling, like feeling of fullness, basically feeling of fullness, not healthy feeling of fullness, basically. And that is gone. When that's removed, what is happening is it immediately goes inside the body and converts into sugar quickly. And that sugar, because to reduce the sugar level, insulin gets released, right? So again, you're eating more, again more insulin getting it. So it is the insulin is create it. So if you see that the more high insulin producing, then what insulin role is to convert fat into sugar, sugar into fat, right? So what it is doing is, so whenever it's saying like glycogen level is filled now, what it does now, it says now glycogen is done, so I need to make you fat now, right? So the insulin started getting fat, and fat getting deposited in the liver and pancreas and other organs. So it is the fat which is getting developed slowly, and these symptoms are happening slowly without your knowledge. So these happening actually. So what happens is, like down the line, 10 years down the line, when these things are happening slowly, one day it will happen. It starts because insulin stops working and says, "No, I can't work because I'm completely exhausted. You have overused me," right? So what happens then after that? When it's overused, it becomes sugar level. The sugar level, the glucose in the blood, it increases. The blood sugar increases, right? So that is the symptom. That is not the disease. Understand? So the problem is the doctors, unfortunately, they're trying to target the symptom, right? Symptom is what? Like, for example, they're trying to cure you, they're giving you paracetamol, Tylenol, and giving you like telling you to like, for the fever. But exactly what is happening? The problem is your infection there in the lung, infection there probably somewhere else in the body, right? They should have given antibiotic for you, but they're not giving antibiotic. They're just simply giving you paracetamol, just giving you the blood glucose lowering medicine, and I'm going to tell you some of the trials. You'll be amazed that I'm going to tell you some of the trials where it says the medications, like what the doctors are doing, the glucose lowering medications are not doing anything good for the not doing anything good in maintaining the long-term complications of diabetes. If you get diabetes, I'll tell you what is happening. Glucose increasing, but as I said, like glucose is getting released. There's too much of glucose in the body, too much of sugar we are eating, right? So what is happening is insulin is getting released whenever we're eating, and that is pushing that glucose inside cells. So when the cells have been filled with this glucose on regular basis, they become rot. When it goes and deposits in the eyes rot, and you become blind, right? When it goes and goes and you stuff too much sugar in the kidneys rot, and you get kidney problem, and you need dialysis, right? So you have it goes and affect every organ. It affects sexual organs. It affects your brain. It affects your arteries, small arteries and big arteries. So there's a lot of complications you're going to have with diabetes, right? So if you see here, these are the diabetes complications you are having. So what is happening is when you take medicine, when you take a cure, you expect that you should not get all these things. But with medications, it's not happening anything like that. It's not going to help. Medication is not going to help. Actually, what they're doing with medication is simply, I have created this image, especially for easy understanding, for you to understand this is what doctors are doing. Already it's tough, and they're still trying to push that inside your, they're not making good that means they're not doing any good to medicine actually harming your bodies, basically. Okay, they're actually harming those. So I'm going to talk about each medicine. I don't know if any doctors are in this group. They should appreciate if I share some of the studies and trials here, inshallah. So this is what currently happening. So doctors, what they are doing is they're just trying to push more and more glucose inside the cell, and the cells are getting rot. And they're saying it, doctor, what happened? You gave me medicine for 15 years, and today I'm getting this eye problem, a kidney problem. Why this? Because it's a progressive disease. No, it's not a progressive disease. It's a lie. It's misconception. It's actually not. It's not updated. Most of the doctors not updated with this. Okay, so that's the thing now. So let's now understand what currently happening with diabetes, current treatment regime, and actually where the cure lies in. Okay. So currently, I'm talking about type 2 diabetes, not type 1. Okay. So type 2 diabetes. The current treatment protocol is on the left side, you see. So they are using insulin, they're using drugs, and they're using low fat diets. This was to 2016, and still a lot of doctors say low fat diet, and a lot of us also think low fat diet is going to help us. No. So when we eat carbohydrate, insulin gets released, correct? It gets converted into glycogen, and that's stored in the liver, right? That's used as energy. When we eat protein, right, they are like our warriors. They are like amino acid, then amino acids. So basically, they convert to amino acids, and they are like warriors. They help in immunity. They help in a lot of things, and that when that increases, if that amino acid increases, what happens is it converts into fat. So high protein diets and or processed proteins like protein bars and protein shakes also not good. Okay, so that's also not good. So protein also not good. So fine. Then let's talk about fat. What happening with the fat? Like fat is required for your body. Okay, so when you eat fat, you require fat to have a good health. Like for example, good brain. You need cholesterol to for your joints to work, for your brain to work, for your memory to work. For a lot of things you require. So you require good fat as well. But what happened in 1970s? The guidelines, they said something else. They said, no, you should reduce the fat. So they reduce the fat to 15-20%. Still a lot of dietitians who have come out from this course recently also, they have come out, they are still on the courses, they have been taught wrongly, unfortunately. They're not been updated, unfortunately. Okay. But in 2016, the American guidelines, they have changed. They said now, they said, okay, fat is fine. You can eat fat now, no problem. They said, okay, avocados, nuts, and olive oil. Before, everything was so dangerous, so dangerous. No. Now they're saying Mediterranean type of diet is actually very, very good type of diet. So I suggest Mediterranean diet, anybody who's not diabetic, they should stick to Mediterranean diet for healthy reasons. Okay, but they have a bit of carbs, a bit of proteins, and a good quality of fat, right? So that's a very perfect diet. So now if you see drugs, I'm going to show you why drugs are not working there. I'm going to show you, I have an example here with me today. One of the patients here, Mr. Imtiaz Ali, okay, who has actually taken this intermittent fasting. He went to a doctor about 20-25 days back, okay, almost 25 days back. He went to a doctor, and the doctor was supposed to be top doctor in Hyderabad, okay. And that doctor suggested him, after seeing his blood sugar level, he started developing actually diabetes since 9 months. Okay, after seeing his blood sugar level of 300 plus, any doctor, right? He's a top doctor anyway. So he said, "We'll put you on insulin." That's when he clicked it. He said, "No, I don't have to go to insulin. Let me go and discuss with Dr. Khan and see what I can do for intermittent fasting." And he said he implemented intermittent fasting. I'm going to show you the results today morning, and just 3 days back, we have even removed his one medication what he was on, just within 15-20 days. That result is, alhamdulillah, this is just 15-20 days. We can see the result that depends upon the chronicity of the disease. Okay, because he was always keeping himself active, physically active, so his body reacted very well to this intermittent fasting. I'm going to explain you why intermittent fasting will work, why low carb diets will not work when you just prescribe low carb diets alone. Okay, so I'm going to explain that as well. So a lot of discussions are there today, inshallah. So Mr. Imtiaz Ali is there. So I'm going to share his sheet as well in a bit. So let me just a little bit understand what more is happening with insulin resistance. So what is happening is the insulin, when we are resistant to insulin, okay, you're developing other metabolic syndromes as well. Okay, you don't know, like you're getting hypertension also because of that. Okay, insulin, as you say, it's like a vicious cycle. You develop obesity with insulin because insulin ka work, uska kaam hi hai, insulin ka kaam hai to convert it into fat, and it's doing this job perfectly. We can't blame insulin, but the only what we can blame insulin resistance, because we develop the insulin resistance because of our food dietary habits, right? So it's a dietary disease. So it has to be approach to dietary interventions. So you can't just try to hide this, like what we are doing currently, just hiding this inside this stuff luggage, inside the stuff glucose. You're just hiding the sugar there inside the cells, and the cells are getting rot, and you're telling it's progressive disease, which is not. Okay. So now we're here, what we are talking about is, so this is what it develops. It develops fatty liver, then more insulin resistance will develop, and you have all these metabolic syndrome. We call it a common metabolic syndrome. Diabetes is a part of metabolic syndrome. Some people will get diabetes and hypertension together. So once we do intermittent fasting, we have seen some results where even people who are diabetic, we remove the medication from them. Even they, alhamdulillah, they were down the line, even hypertension was also was very helpful to lot of patients. If suppose that hypertension they develop because of metabolic syndrome. So it's a part of metabolic syndrome. So when you eat fattening carbs, a refined and processed carbs, without understanding the carbs, we need to be very, very, very updated, because this world has put us to such a level that unless we're not updated, we will not be. Let's talk about the health side. We'll not be healthy, because we need to be completely updated what is going in our mouth. We need to see the labels, what we're eating from our mouth. We should be very, very cautious, and particularly, especially people who are diabetic, they should avoid carbs. So what we basically prefer, what we tell is, okay, let me just go a little bit about diets. I'll go a little later, diets and intermittent fasting. But before that, let me jump to this one. Current drugs. Okay, current drugs, if you see here, a lot of doctors here, the prescribing everywhere globally, they're prescribing sulfonylureas. See, if you see Mr. Ali, he was on a sulfonylurea drug. He was on this drug, and actually, this drug is what is doing the side effect of the drug. So when you see this here, it's releasing insulin. And we are saying insulin is not good when somebody is diabetic, because insulin has already been released and been depleted, and that's why you're showing diabetes there, correct? So here, what is happening is you are again trying giving medication and asking the pancreas to release insulin again and again. So what is happening? The side effect, especially when you give this medicine to an obese person who has a BMI more than 30, if you're giving insulin to this person, what is not doing anything good, it's actually worsening his disease, right? Because insulin does what? It increases weight gain, because it is converting into fat. Insulin का role है to convert excessive sugar into fat, correct? So when it's converting into fat, how can you give a insulin again? Correct? Yeah. So here we are. So weight gain is the issue. The other issue is vascular disease. With insulin, what is happening is insulin is this is vascular disease, like hypertension is a part of vascular disease, right? So here, what is happening is insulin is creating vascular disease, because insulin ka kaam hi hai wo, right? It is doing its work. It's not doubt. It's not the insulin's issue, problem. It is the problem of the medications which are being like completely, because these kind of medications actually, if you see the trials of these medications, I can, let me just tell you a bit about trials. I don't know if any doctors out there, they'll understand the trials here. So UKPDS trial in United Kingdom, right? That is, and 250,000 people, veterans database, USA randomized trials were conducted. And all these trials have said, they have come to the conclusion this, because of the trials, the sulfonylureas, okay, these kind of drugs are usually actually in India and in UK, they usually give a lot of metformin here as a first medication. In India, they give sulfonylureas mostly. Okay, and different countries they use different because of different reasons. Okay, because of different reasons behind that. The cost is the factor. Then a lot of other factors are there. So because of that, they choose different medication for different countries. So that's, if you see sulfonylureas here, they have done randomized trial. They have done 250,000 veterans database USA trial, and the randomized trial that are supposed to be gold standard trial, right? So with that, they came to conclusion that it increases weight gain and it is vascular disease. So when it increases weight gain, how it is going to help diabetes? Tell me. Actually, you're spoiling. You're giving medication. You're taking. Your doctor is giving medication, and actually is actually spoiling the whole issue there. Actually, the root cause is insulin, and you're giving more insulin. So what happens? You put on more weight, more resistance you develop, and then you develop vascular disease along with it, right? And that's all derails the efforts of you. Yeah, just all the illusion. This is completely illusion. When insulin is being given, like sulfonylureas, he will get glucose level will come down and he will feel good, Doctor will, this is all illusion, to be very frank. This is not good. This is where he's putting the sugar to. He's putting the sugar in the cells, and the cells are getting rot day each and day. Okay. So now let's put a metformin here. So metformin is very common drug in US, and they did uh, it prevents gluconeogenesis. Sulfonylureas releases insulin, so it prevents gluconeogenesis. Like it doesn't allow production of new glucose cells. That's what gluconeogenesis is. It stops. It prevents the liver from providing producing new glucose. So that's why blood sugar level will come down definitely. But what the other side effects is like lactic acidosis. This is very rare side effect. I can understand. This was another test, but then by UKPDS by here only another trial. But the issue here with metformin is you need to keep on increasing dose every few days. And all this drug is again not taking care of the insulin problem, the insulin, that is the root cause. Correct? The root cause has to be targeted. This is not taking this sulfonylurea targeting that. Metformin is not targeting that because prevents gluconeogenesis, right? It is not insulin, but it prevents. It's stopping the liver to produce new glucose, and new glucose is getting converted to just not going into the thing, but it's forming that back in the fatty liver, is converting into fatty liver, so it can come into lactic acidosis or more drugs. So that is the major issue with metformin is you need to keep on adding more and more on drugs. When you want to stop this drug, another side effect is another side. Not I can say side effect, but another issue with this drug is when you stop metformin. Okay, so what happens is you need to have very strong dietary interventions to actually cope up to that when you stop or you change metformin to some other medication. That's another issue with this drug. So every drug comes with a lot of issues, you know. So now you have other drugs here, which I talk about, where you have. Let me talk about the weight loss medications, okay, like which is very common now. A lot of people are ordering these weight loss tablets in UK, okay, here, and it says fine, you're losing the weight, that's fine, but you losing weight will definitely will helping you in losing the diabetes at the same time, right? But you have, it comes with a lot of side effects, right? Like for example, what it does is SGL2, which is like these are the two medications there. So blocks reabsorption in the kidney, so it blocks reabsorption in the kidney and lowers blood glucose, sorry, blood glucose, blood and blood weight and blood pressure. It helps it, but it what is happening is when you see the A1C, okay, that's the hemoglobin HbA1c we call it. What happened is whenever that's one of the testing criteria there, like fasting blood sugar, post lunch blood sugar, we do like oral glucose tolerance test we do. Then we do this another test, it's HbA1c. So what is happening is RBCs have uh, hemoglobin in that, correct? So this glucose is going into, because every cell, so it's going getting deposited in the hemoglobin, right? So so it gives a 3 months average of your hemoglobin because the lifespan of the RBC is 3 months. So it will give you 3 months average of hemoglobin. That's called HbA1c. That has dropped marginally moderately. That means it has not drastically reduced it in infection. So other complications and infections are there. It could develop something called ketoacidosis. Yeah, but it helped by death, by it reduces the death by 38%, kidney diseases by 40%. It helped that. Okay, this medication, weight loss medications, they come in okay format kind of medication, but I'm going to tell you why these medications should not be used. I'm going to tell you that as well, because they are helping in weight loss, fine, right? They are helping in reducing the debt also. But when you compare, when you are comparing this with some other drug, then it's saying it's death reduced by 38%, correct? Then, but still happening, right? It is reducing by kidney disease by 40%, right? But the major infections and ketoacidosis, because when you're releasing blocks reabsorption in the kidney, what is happening is you try to pee out the glucose from the pee. But when you're peeing a lot of glucose from the when you're peeing a lot of glucose, the chances of infection are there. But we can control that with antibiotics and all that. That's okay. But I'm going to tell you why even this is not going to help in long run. Okay. So now if you see another drug is there that's called GLP-1. Okay, that this mimics incretins hormones. I don't want to take you in more detail here unless some doctors are there who want to be interested to know more on that trial. So I just make these people. So let's just jump on the final conclusion on the drugs. Okay, final conclusion is this: Accord, Advance, VRDT, and Origin studies. These I'm talking all the studies. I request you guys to take the screenshot and do some research from your own side. Okay, all these studies have said and proved the fallacies of glucose lowering drugs in preventing long-term complications. you like, they have done most of the tests was that what most of the trials were like when somebody is giving medication, when you're on some medication, they did trial whether that medication is helping you in preventing long-term complications or not, right? So but most of the drugs it says like it's not at all helping in the preventing long-term complications. So most of the drugs fall into that bracket. Okay, so now what doctors and patients think and what is the fact. Okay, doctors and patients think it is a chronic and progressive disease, which what is in fact it's a lie. Now you know that it's not a chronic and progressive disease. It is just because they're removing the glucose from your blood and they're shifting it to in the cell, and cells are getting rot, right? That's there, you know that. Medication are primarily to, that's again lie, because all the trials say something else. Okay, insulin in type 2 diabetes is a death warrant, we all know, because we can't give insulin in especially type 2 diabetes. When especially type 2 diabetes in insulin develop insulin resistance, you're giving more, and if suddenly they'll increase weight like crazy, and just you can say that increase their weight to almost 8-10 kg in just span of 30-35 days only, right? So that's what insulin does to your body. Then fasting can lead to sudden hypoglycemia. Okay, lie. It's again a big lie, because how can, why? Because it's a lie. Because why it's lie? Because we are there and to give you give you the expert guidance and monitor, and so we have all the tools when somebody is coming on intermittent fasting. Okay, we give you the tools and all the guidance, and we keep you track on that. We give you track sheets and all that, and we give you all the information, required information, how to deal what and what to deal what. We put you in the groups. We put you in WhatsApp group where you have doctors, and where you have even the dietitian there to ask questions. You have any questions related to diet, so you can ask those questions with. Okay, then exercise and diet is enough. It says again. I say the exercise and diet is not enough. Lie. Both increases compensatory hunger. And I'm gonna when I open my second presentation now in another 2 minutes, inshallah, I'm going to take you into detail of diets. Okay, so what kind of diet we should include, and why fasting wins when we compare with low carb diet, when we compare with them. So why we need to combine low carb diet with fasting. So we're going to explain everything. So exercise and diet is enough. It says it's a lie, but I'm going to explain you why. What studies say, what are the studies which are saying when somebody doing exercise, especially obese person doing exercise, what are the results which we found? I'm going to tell you that as well. Okay, so now it's a lie because it increases compensatory hunger, simple word, right? Then fasting causes starvation. People think हम fasting करेंगे हम मर जाएंगे, right? It is a myth, because fasting is the only intervention. If you want to have a result like Mr. Imtiaz Ali, in just 25 days, he's off medication, you need to include fasting there, right? With proper guidance, with our guidance, okay? Because fasting helps in releasing the hormones. By low carb diet, when you eat low carb diet, you're again releasing insulin, which is not good to the body, correct? But when you're doing this one, you're releasing some very good hormones, and you actually your basic metabolism are increasing. When you put people in a low carb diet, what is happening is people are losing the. I'm going to explain. Let's not jump into quickly here. Let me go to the other sheet now. So let me go to the other sheet and let's discuss about the diets now. Okay. Bismillah. So fasting causes starvation. It's a myth. It releases hormones. So let's go now and see all these things. What I said, this last 3-4 things. Let's go and see what I'm telling is making sense or not. 1 second, please. Let me open my presentation too. There you have, in this, we are trying to compare different strategies to reduce the medication. We know medication has failed after the trials. Okay. There's some medication are there which are helping in losing weight, but still they're not working on the root cause. Root cause is insulin, high insulin, right? That's the root. That's the problem with diabetes. High sugar is not the problem. High sugar, what you're seeing in the blood is just a symptom. Remember that. It's just a symptom like a fever. Okay. So now let me share the screen and discuss about the. Okay, so what is historical? What is, let's talk about a little bit of fasting. Why, if fasting is so historical, and why ancient practice? It's such an zero. You don't have to spend anything for fasting, right? You are with zero investment, you're getting amazing benefits. And why God has made it mandatory in most of the religions, most of the cultures. You see, fasting is like a deep roots in the religious traditions. So it often stick with adherence and consequence for non-compliance. So if you see, dieting, fasting is there in Christianity, in Jews. Then you see fasting is prescribed in Muslims. Alhamdulillah, it's like, so it's mandatory. Why mandatory? God knows the structure of human being. God knows. And before, if you see, uh, before Prophet Muhammad Sallallahu Alaihi Wasallam, right, when this fasting had been enforced on us, you can say obligated on us. Before, it was no obligation was there, but now it's obligated, because God knows, because we will start hooking to refined foods. We'll become more from hunter gatherers. We are becoming more modernized, and we are getting more processed foods. So he knows it. So that's the reason it is mandatory for you. It is for your own good. It is for your own good. So this we need to understand very well, that there is a huge health implication to that. So if you see the historical endurance of fasting practices, which may indicate its effectiveness in managing metabolic diseases, right? So it does help in metabolic disease. I'm going to explain how it will help in metabolic diseases. What is the benefit of fasting, and we'll try to compare it with other strategies, like like low fat, low fat. What will happen when we eat low fat? Because that was till now, till a lot of doctors who are not updated, they still say, a lot of dietitians, they'll still say have low fat, right? So, but it's not doing anything good there to your body. Why it's not doing good? Then what will happen when we give low carb diet? What will happen when we put somebody in intermittent fasting? We'll see all these things right now. Okay, so this is a little bit of understanding of why there's an ancient practice of fasting, why fasting is a very old tradition, why they did the fasting, why it is being popular there, and why it's been obligated by most of the religions here. So global adoption is there, then discipline is there. With discipline and diabetes goes hand in hand. Okay, with discipline is so important. Like, for example, what is going in the mouth is so important. That's a discipline, right? So you need to have the discipline to control, self-control, and cultivate those religious fasting analogous to the discipline required to manage type 2 diabetes efficiently. And there's a punishment also there, and prevention is there. So we all know that, so I don't want to discuss much on that. So evolutionary insight into fasting. So that's that. I already discussed that. So now modern fasting and culture. Now let's discuss about modern fasting. What is happening current trend? There's a study done, okay, among doctors, among 900 female physicians. Okay, so let me just zoom in there. See the study here. Okay, I don't know if you guys can see this. Okay, so 900 physicians are there. Okay, so I'll just wrap it up very quickly. Just give me 5 minutes, please. Yeah. So 900 physicians are there, and these physicians, what they did, physicians want to lose weight. What physicians have done? Okay, the female physician, they have done themselves intermittent fasting. They're doing fasting, but they're not telling their patients to do fasting. So this is a big proof here that they did 900 people, physicians were examined. So one of these studies which they conducted, and they said this average BMI was 24.9, average weight loss is 13.2 pounds. Like, like if you see 55.3% people, physicians lose weight at least 10 pounds. And from there, 6.3% lost more than 40 pounds. Yeah. So that is what we need to understand, that current fasting trend is today's health conscious society has embraced intermittent fasting. A lot of people have embraced that. A lot of people are using that, but unfortunately, doctors are still being blindfolded by the what do you call that? Blindfolded by the pharmaceutical industry, the big and fat pharmaceutical industries. Correct. So that's what I'm trying to explain you now. Here, let's talk about a little bit about what happened in enforced fasting during wars. Okay, during World War I and World War II, the food was rationed across the Europe because of World War I and II, and they restricted all foods, not just sugars. All foods were restricted. And what happened to the mortality rate? Mortality rate with diabetes significantly dropped down, but increases between war as people went back to their custom eating habits. Understand? So enforced fastings during wars, actually you see mortality rate of diabetes being dropped down. Correct? Well, other way to lose weight is bariatric surgeries like gastric banding, or making the volume, the stomach volume, reducing the stomach volume so that you eat less, and with that you creating. So this bariatric surgery for weight loss is now, if you see the study which they have done to understand whether it really is fully reversible, and that shows that diabetic type 2 diabetes is fully reversible, because when you do go ahead, well, when you go for a bariatric surgery, that's what I said, right? If you see the cure and the not cure and the poster also, when the cure is the surgery, that's bariatric surgery, like, surgeries, like, for example, gastric banding and all that, right? So if you see that 2012 trial called Stampede trial, okay, what they did, they compared the effects of gastric bypass with intensive drug treatment, right? What will happen? So what was the outcome? What was the outcome? It was astonishing outcome. Surgical patients did amazingly well. जिसको सर्जरी करके within 3 months उनके पूरे medication stop हो गए. All medication stopped, leading to complete remission. And there is sudden calorie restriction leading to burning. So what happens here? Because when you cut down the volume, you suddenly have reduced the calories. You're not eating that much. You put that, you seal the mouth, right, with with surgeries. And what happened? It started burning the liver glycogen, right? Then liver glycogen get exhausted. Then it goes to where? Visceral fat, right? So visceral fat gets started burning. So people started losing weight. Not only weight, there even super obese adolescents, right, who got this bariatric surgery done, they enjoyed the same success. Even the hypertension resolved in almost 74% of people who develop hypertension because of metabolic syndrome, because of high insulin. Remember that. You're developing all this because of high insulin. Okay. So hypertension also, obesity also, the triglycerides you're rising, like a HDL, which is a good cholesterol that's coming low. So all because of metabolic syndrome. That's because of insulin resistance, right? So that is also gone. Can you see this? But the problem here is surgeries is very high price, correct? And is both physiologically and financially very burdensome, and psychologically also. So that's why we kept it side. People who can afford, they can go it, but it's cost there. Okay, and it comes with a lot of and comes with a lot of issues as well at the same time. Now, low fat era. What has come in the low fat era? Okay, let me jump now. We don't have time, brother.
I think we have completed the work. We need some question and answers time.
Let me just take them to one final thing so that they understand. First, let me just show a little bit about this one. What happened when somebody do exercise? हम बोलते हैं exercise से हो जाएगा. Doctor बोलते हैं move more and eat less. So well, see, we'll talk with the statistics and data. We'll just not listen to anyone, right? Because this didn't help us. All these years, doctors said, but nobody has got cure from diabetes because of these implementation. What happens is, I'm going to tell you, right? So if you do exercise, effect of exercise training intervention and energy intake and appetite control in adults with overweight or obesity, a systematic review and meta-analysis was done in 48 studies. 48 studies का included ये है कि people who are obese, they actually compensatory increase in fasting hunger. Okay, so what is happening here is, you because of exercise, there's compensatory increase of hunger in your body. Because of low carb diet, there's a compensatory increase of hunger in your body. So let me just quickly, now he's again looking at me. Let me just quickly, I need to share so many interesting facts, man. So many interesting facts. People should know all these things, brother. So let's quickly share them, a little bit of differences between low carb, and that's what the final thing I'm doing now. This is the final slide, please. So low carb diet, the difference, so the major difference between low carb diet and intermittent fasting. So low carb diet, to follow low carb diet, person needs accurate information and guidance, definitely, right? So you need to understand what is carbs now, because the carbs is completely complicated issue today. Like so much of processed carbs that are out in the market. So you don't know what to eat, what not to eat. So we will guide you there, okay? But you require support there. But intermittent fasting, if you say, anybody can do it. It's safe and a strategic approach to lose weight, and it's without any penny investment, and it's helping you in overall health. I'm going to explain you how this intermittent fasting is helping you in long run. So the low daily calorie restricted diet saw their insulin levels drop but quickly reached a plateau here. Let me just share this one. Daily restricted diet kya ho raha, or fasting se kya ho raha. This is the chart. I want everybody to see this, please. So if you see this, हमारा क्या problem, हमारा target क्या है? Our target is to reduce insulin, correct? Everybody. Sorry, I can't hear anybody. So anyway, so our target is what? So our target is to reduce insulin, correct? So insulin is getting reduced. If you see, with low carb diet and chronic calorie restriction, There's intermittent fasting and chronic calorie restriction, low carb diet, basically. So if you see that, it's coming down, insulin is falling down, falling down, falling down, falling, but it has reached one plateau. It can't fall on more than that when you have on a low calorie restriction. But intermittent fasting, it can down to you very like a baby, like to when you were so young. So your insulin levels are to the extreme low, right? It has gone. It can only happen in the intermittent fasting. With chronic calorie restriction, you start losing that, but at the same time, at one stage, you don't lose more than that. So you are stuck there. So you are stuck. So best approach is definitely again intermittent fasting has 1 year. Okay, but I'm not telling we can't just remove low carb diet from that. No, we need to have low carb diet along with intermittent fasting. So let me just quickly finish another 2, 3 things, points. Then you can have a lot of questions. So I want you to ask me. It does not produce much hormonal changes. Like, okay, like low carb diet not doing any hormonal changes. What is happening in intermittent fasting actually producing a very beneficial hormonal changes in our body, right? Where chronic depression not happening. Hormonal changes. What happened in hormonal stages? If you see, our sympathetic nervous system increases. When sympathetic nervous system increases, our basic metabolic rate increases. When basic metabolic rate increases, our energy level increases. Our for example, the you feel warm in the body and all that, so that basic metabolic rate is increasing. And at the same time, why basic metabolic rate is increasing? Because growth hormone is increasing, noradrenaline is increasing. So some hormones are getting released in intermittent fasting. With low carb diet, none of the hormones are getting released, right? So when these good hormones are getting released, what it does is they are improving your lean mass also. Overall lean mass of a body is so important. With age, we deplete that. With age, we lose that lean mass, right? But with this, with fasting and with other, with low carb diet, we lose that. But with this, you actually increasing the lean mass by 2.2% because your growth hormone is getting released there. Understand? So you have this tremendous benefits with intermittent fasting. I think everybody should start doing intermittent fasting. I do intermittent fasting every day. Like what I do is I just keep my breakfast. I try to have my breakfast at a later time as much as I can. But I'm not diabetic, alhamdulillah, but still I try to do that, keep myself healthy, because I know sometimes you just go overboard when you're with your friends and your family and all. They just keep eating and hogging yourself. So that's why. So it's always better to be preventive. So it's intermittent fasting help in preventing your disease as well. I think this is fine. Actually, with increases weight. Okay, another thing is before he comes, because I promised him 5 months, so 5 minutes. So the other thing is associated with so what is happening in portion control? When portion control strategy is there, your metabolic rate is decreasing. So what happened is they did an experiment on this, the trial on this. They fed people with low carb diets and they told them to eat this much of diet. They reduced at least 500, 600 deficit. They did calorie deficit when they from their diet, and they have done some test later on, and they have seen that the basic metabolic rate has actually decreased. They started feeling cold in the hand. They started feeling weak and fatigue. Just low carb diet won't help. So you need to add that with intermittent fasting to get best results there. Now, another thing which is very important, I want to face final is there are many things to say final, but this is a very important thing which I need you to understand. Everybody should know this, that increased risk of regain. The risk of regain. If you see exercise, you have increase of risk of regain. I'm just not talking. With your experience also, you can understand. I can share some of the data also of that if anybody is interested. So increased risk of weight regain is there with low carb diet. But when intermittent fasting is there, you're losing weight. That losing weight is permanent. You don't get back that weight, right? And when you're exercising the body. You're not exercising your organs. So main problem is the organs, because आपके liver में आपके fat जमा हो गया, वो fat हटाना है, right? कैसा हटता? Medicine तो नहीं है उसकी कोई. क्या है? Intermittent fasting है. Simple reason, right? So let's do intermittent fasting, everybody, for health reasons. Thank you.
Barakallah. Jazakallah khair, Dr. Abdul Mutalib Khan. And as you have not only shared valuable insights, but also demonstrated how integrating the modern medicine with alternative therapies can pave the way to informative health outcomes. This historic event marks the beginning of a new chapter in our collective efforts to reverse type 2 diabetes. The strategic and knowledge we have gained today are powerful tools that can reshape lives, reduce the burden on healthcare systems, and promote a healthier future for all of us, inshallah. We extend our deepest gratitude to Dr. Khan for his inspiring presentation and to all of you for your active participation. Together, we are forging a path towards better health driven by innovation, compassion, and a commitment to holistic well being. To connect with Dr. Khan, you may reach out to us via our website or contact us directly at our contact number. And without taking much of the time, now we shall open the floor for your questions and answers with the doctor. And Jazakallah khair once again, and we look forward to continuing this journey. Bi ta'ala.